Welcome to the Guidance Functions webinar on registry data. In this webinar on registry data, we will cover the following areas: health data, the process for applying for registry data for a pure registry study, data providers, authorization and permissions, applying for data and analysis platform. Firstly, we would like to provide some information about health data in Denmark. In Denmark, every citizen has a civil registration number, which makes it possible to follow the individual through the entire course of treatment and their general life. This information is registered in the many registers that exist in Denmark. The civil registration number therefore makes it possible to combine information across the registers and thereby create the opportunity to carry out unique research. A widely used register within health research is the National Patient Register, also called LPR. It is the central register for monitoring and control in the Danish healthcare system, and data is entered when the patient has been in contact with the hospital service. The data is then transferred via a patient administration system, like the electronic patient record, to LPR, from which data is distributed into different registers depending on their function, category, and use. Finding the data you need for your research can be a significant challenge. You must determine where the data exists and which registries you wish to obtain data from. Multiple registries may contain similar data, which you should be aware of when selecting a data provider, as different data providers may not always update their data simultaneously. You only receive the data that is necessary to carry out your research project. As a researcher, you must therefore pay close attention to and decide which variables in the datasets to apply for. If you happen to forget or overlook a variable that you later wish to include, you will need to reapply for data access, which can increase the project's costs. Data providers and data. There are many different data providers in Denmark, and some of them contain various types of data, including some overlapping data. For example, the National Health Registries, managed by the Danish Health Data Authority, contain a significant portion of our health data. In contrast, Statistics Denmark has its own socioeconomic data along with some health data, which they receive from the Danish Health Data Authority once a year. Additionally, there are biobanks that house various biological materials. Applying for registry data. The application process with data providers in Denmark varies depending on which data provider you are seeking data from. Some data providers require that you are affiliated with an authorized research environment before they grant permission to access and work with their data. This requirement is applicable, for example, with the Danish Health Data Authority and Statistics Denmark. Authorization for access to data is granted to permanent analysis environments, and this authorization is given on an institutional and departmental basis rather than to individual researchers. Authorization is based on an assessment of a research environment's research activities and its familiarity with the use of registry data and data security. It is the research environment itself that is authorized, and the head of this research environment is responsible for the authorization. Access to data from the Danish Health Data Authority or Statistics Denmark can only be obtained if a researcher is affiliated with an authorized research and analysis environment. Authorization is only granted to permanent analysis environments, and it is provided on an institutional and departmental basis, not to individual researchers. Once you know which data you want to use, it is the researcher's responsibility to apply for the relevant and mandatory approvals in the correct order. All projects that store or process personal information or data must be listed on the record of processing activities. A record of processing activities is documentation of information about who processes personal identifiable information, which data is used, and for what purpose. An exception is projects where only anonymized data is used. These projects do not have to be reported to the record of processing activities. The record of processing activities is available in the regions and at the universities. Private companies must keep records of processing activities themselves. Notification procedures, templates, and such varies among regions and universities. Where you have to report your project depends, among other things, on where you are employed. In the region of southern Denmark, notification to the record of processing activities is based locally at the hospitals, but in other regions it is collected regionally. The Danish Health Data Authority and Statistics Denmark are two of the major data providers we have in Denmark. The Danish Health Data Authority exclusively has registers containing health data, while Statistics Denmark manages registers covering a significantly broader range. If a project requires socioeconomic data, researchers need to apply to Statistics Denmark. The update frequency for the registers and data at the Danish Health Data Authority and Statistics Denmark differs. The majority of the registers at the Danish Health Data Authority are updated for research purposes on a monthly basis, with some updated annually, such as the cause of death register, or multiple times a month, like the pathology and the central person register. At Statistics Denmark, the registers are updated at least once a year. It is important to note that the units responsible for providing data for research purposes at the Danish Health Data Authority and Statistics Denmark have very similar names. At the Danish Health Data Authority, it is called Research Services, and at Statistics Denmark, it is called Research Service. You can transfer data from the Danish Health Data Authority to another data processing location, such as Statistics Denmark, but it is not possible to transfer data from Statistics Denmark to another data processing location. The analysis platform at the Danish Health Data Authority is called the Secure Research Platform and the Research Machine at Statistics Denmark. When applying for data from the Danish Health Data Authority and Statistics Denmark, the application processes are generally identical for pure registry studies. It is important to note that there will always be a processing and delivery time with the data providers. You can find more information about the different delivery times on the data providers' websites. Analysis platforms. When data is provided, it is the responsibility of the researcher to ensure that the data is stored on a secure analysis platform and in a secure analysis environment. This can be on the data provider's analysis platform or on internal platforms where logging is in place to track who accesses and processes the data and when. In practice, there may be circumstances that dictates the choice of the analysis environment in advance. This could be due to authorization, the need for socioeconomic data, or specific software requirements. Both the Danish Health Data Authority and Statistics Denmark offer SAS, Stata and R, while Statistics Denmark also provides a few additional programs. In addition to the Danish Health Data Authority and Statistics Denmark, there are many other data providers and opportunities for accessing health data. Much of the health data available through the national health registries is also accessible through regional databases. These databases can be accessed through the regional business intelligence offices, which provide data from hospital IT systems. Data is provided to clinicians, hospital management, regional authorities, and politicians, but it can also be accessed for research purposes. Access to data from here requires permission for transmission from the regional council. It is also possible to obtain data about patients' illnesses and their healthcare journey through the Regional Clinical Quality Development Program. Data is collected in various quality databases, and data can be provided from here for research purposes. At the Danish National Archives, a wide range of data about citizens, businesses, environmental conditions, and more can be accessed. If you wish to use biological material for research purposes, this can be obtained through Bio and Genome Bank Denmark or the Danish National Biobank. This was the Guidance Functions webinar on registry data. Thank you for watching.